When someone we love is getting older, it's natural to worry about their health and well-being. We want to make sure they are safe, comfortable, and cared for. But sometimes we may start to notice small changes that make us pause. They may seem tired more often. Maybe they're forgetting things or pulling away from others. These changes might be small at first, but they can be signs that a person is approaching the final chapter of their life. This can be a very hard thing to think about. It can feel sad, scary, overwhelming, but it's also an important time. When we understand what to look for, we can better support our loved ones. We can give them more peace, more comfort, and more love when they need it most. It's important to remember that not every elderly person who shows these signs is in their last year of life. People are different. Some may show these signs and live for many years. Others may seem fine until the very end. But the signs we're going to talk about are often seen in people who are getting closer to the end of life. They are subtle, but they matter. You may notice one sign. You may notice all five. Either way, what matters most is how we respond, with patience, kindness, and care. These signs don't mean giving up. They don't mean we stop loving or helping. In fact, they're a reminder to be even more present, to listen more closely, to hold a hand, sit beside them, and make sure they feel seen and valued. Many people feel unsure during this time. They may ask themselves, am I imagining this? Or what should I do if I see these changes? That's completely normal. There's no perfect answer. But by learning what to watch for, we become better caregivers, better friends, and better family members. Some of these signs are physical. Some are emotional or mental. Some involve the way a person talks or connects with others. They might talk about the past more. They might want to be alone. They might not eat as much or have trouble walking. These signs often appear slowly, so it's important to be patient and gentle. As we go through each of these 5 signs, try to think about your loved one. Has anything changed? Have you noticed them acting or feeling differently? Have you had a sense, deep down, that something might be shifting? That quiet feeling, something's different, something's fading, is often real. And it doesn't mean we panic. It means we prepare, not for loss, but for presence. It means we find ways to be there for them in the most loving way possible. This is not just about recognizing signs. It's about offering comfort. It's about making sure no one feels alone. It's about creating peace when life becomes more fragile. The end of life doesn't have to be full of fear. It can be filled with soft moments, with whispered words, with love that speaks even when no one says a thing. By being aware, we can give that gift to the people we love. So let's begin by looking at the first sign, one that is often missed or brushed off as simply old age. But when we understand what it really means, we can see it as a gentle signal calling for extra care. Physical decline. One of the first and most noticeable signs an elderly loved one may be in their final year of life is a steady decline in their physical strength and energy. This doesn't always happen suddenly. Often, it starts small, but over time, the changes can become more visible and concerning. You might notice that your loved one sleeps much more than they used to. They may take longer naps during the day and still go to bed early in the evening. They might wake up late in the morning or appear groggy for hours after getting up. Sleep becomes a larger part of their day, and they may seem tired even when they haven't done anything physically demanding. This increase in fatigue can be the body's way of slowing down. As the systems of the body begin to work less efficiently, more rest is needed. The heart, lungs, and muscles may not function as well as they once did. Tasks that used to be easy, like getting dressed, brushing teeth, or walking to the bathroom, can now feel exhausting. Sometimes they may avoid doing things simply because they don't have the energy. They may not say much about it, but you might see them sitting more often, choosing not to go out, or saying they are just tired today. At first, it might seem like they are just having an off day, but if it happens more often, it's something to pay attention to. Weight loss is another common sign. Even if your loved one is eating a normal amount of food, they might begin to lose weight. Their clothes may fit more loosely. Their face might look thinner. You may notice their arms or legs getting smaller or their skin looking more delicate. Sometimes the loss of appetite comes first. They may begin to eat less without really knowing why. Foods they used to enjoy might not interest them anymore. They might push away their plate or say they are full after just a few bites. There are many reasons this happens. As the body begins to shut down, digestion slows. Hunger signals from the brain may weaken. Food might no longer smell or taste as good. Chewing or swallowing might become harder, especially if there are problems with teeth, the throat, or coordination. You might hear them say that everything tastes bland or that they just aren't hungry. Some people also begin to drink less water. This can lead to dehydration, which makes them even more tired and weak. It can also cause confusion, dizziness, and headaches. If your loved one is not drinking enough, you may notice dry lips, darker urine, or difficulty going to the bathroom. Another part of physical decline is reduced mobility. Walking might become more difficult. Your loved one may shuffle their feet or use furniture to steady themselves. They might move more slowly or need more help getting up from a chair. Stairs can become frightening or impossible. You might see them lose their balance more easily or appear unsure when standing. Falls are a serious concern. Even a small fall can lead to broken bones, bruises, or fear of moving around. After one fall, many people become afraid of falling again. This fear often leads to them moving even less, which makes the body weaker. It can become a cycle that's hard to stop. You might also see that they are holding onto things more tightly. Their grip might be weaker. They may drop things often or have trouble opening containers, turning doorknobs, or using utensils. Dressing themselves can become frustrating. Buttons, zippers, and shoelaces can feel impossible. This loss of independence is often hard emotionally, even if they don't say anything about it. Their posture might change too. They may appear hunched or lean to one side. Sitting upright for long periods may be uncomfortable. You might notice they slump or need more cushions to stay comfortable. Their skin might become more fragile, with bruises, dry patches, or sores. Pressure points, like the lower back or heels, may develop redness from sitting or lying too long in one position. Some people also experience changes in their breathing. Their breaths might become shallower, or you may notice them breathing more slowly or quickly than usual. Sometimes they breathe with more effort, especially during activities or when lying down. Breathing changes can happen quietly, so it helps to pay close attention. Cold hands and feet are also common. As the circulation slows, the body directs blood to the most important organs. This can leave the hands and feet feeling cool, pale, or bluish in color. You might notice them pulling on blankets more often or feeling cold even when the room is warm. Another thing to notice is how often they get sick. If your loved ones seem to catch every cold, take longer to recover, or feel run down much of the time, it could be a sign that their immune system is weaker. Even minor infections like urinary tract infections, coughs, or skin problems can take a toll. Frequent visits to the doctor or hospital may become part of life, with less energy to bounce back each time. During this time, small changes in hygiene or appearance can also become noticeable. They may shower less often, forget to brush their hair, or wear the same clothes for several days. This may be due to physical fatigue or lack of interest. It's not laziness or carelessness. It's often just too much effort. It's important to approach these changes with kindness and patience. Physical decline is not something your loved one chooses. It can be frustrating and frightening for them. They may feel embarrassed or even angry. Try to listen more than you speak. Offer help gently, without pushing or rushing. Let them keep their dignity. Simple things can make a difference. Helping them sit near a window with sunlight. Offering soft, easy-to-eat meals. Making sure they have water nearby. Using pillows or soft blanket to support their body. Encouraging short walks if they are able. And most importantly, being there, your presence, your voice, and your calm support me more than you may realize. If you notice physical decline, talk to their doctor. They may suggest home care, physical therapy, or other support. They may also talk about what kind of care will be best going forward. Sometimes this means shifting the focus from curing illness to providing comfort. This kind of care is called palliative care, and it can help improve quality of life when someone is very ill. Every person is different. Some may decline quickly, others slowly. What matters most is being aware, being gentle, and staying connected. When the body begins to slow down, it's a sign that more care is needed, not less. It's a sign to lean in, not step away. Now let's look at another sign, one that doesn't show on the outside, but can have just as much meaning. Changes in mental alertness. As the body begins to slow down, the mind may also show signs of change. These changes can be subtle at first, but over time they may become more noticeable. Mental alertness is the ability to stay focused, think clearly, and respond to what's happening around us. When someone is nearing the end of their life, their level of alertness often begins to fade. You might begin to notice that your loved one seems more forgetful. This can go beyond simple memory lapses that are common in aging. They might forget the names of people they've known for years. They might repeat the same question over and over. They may not remember what day it is or where they are. Sometimes, they might seem lost in their own home or get confused about time, thinking it's morning when it's evening, or thinking someone who visited days ago just left the room. These memory problems can feel scary for both the person experiencing them and for their loved ones. You might try to remind them gently, only to find that they forget again within minutes. It's important to stay patient. Try not to correct them harshly or show frustration. This isn't something they can control. Their brain is processing things differently, and it's not their fault. Another sign is difficulty following conversations. Your loved one may seem distracted when you talk to them. They may ask you to repeat things often. They may lose track of the topic and suddenly say something unrelated. Or they may stop talking altogether and just listen quietly without really responding. In some cases, they may even misunderstand what's being said and become upset or confused. It's not uncommon for people in this stage to withdraw from conversations entirely. Talking may take more energy than they have, or they may feel embarrassed that they are not able to keep up. You might see them nod and smile without really understanding, or they might respond with short answers like yes, okay, or I don't know. There can also be changes in how they express themselves. They might forget common words or say things that don't quite make sense. Sentences might trail off halfway through. They might call things by the wrong name, like saying door when they mean window. They may also mix up names of people, even close family members. This can be painful to witness, but it's not a sign that they love you any less. It's simply the mind becoming more tired. Some people begin to hallucinate or see things that aren't there. They may talk to people who have already passed away. They may describe things in the room that no one else can see. This can be frightening, but it's often not harmful. In many cases, these visions bring them comfort. If they are not distressed, it's usually best to listen calmly and respond gently rather than try to convince them otherwise. Disorientation is also common. Your loved one may not recognize where they are, even if they've lived in the same place for years. They might think they are in a childhood home or believe they are getting ready to go to work. Some people pack bags, thinking they are about to go on a trip. Others may ask for people who aren't present, like parents or siblings who pass away long ago. In the final stages, the mind may move in and out of clarity. There may be moments when your loved one seems completely aware, followed by periods of confusion. This can be especially emotional. You may treasure those moments of clarity and feel deep sadness when they fade again. This back and forth can continue for days, weeks, or months, depending on the person. During this time, emotions can also shift. A person who was once cheerful may seem sad or anxious. They may cry for no clear reason or become fearful. In some cases, they may even become suspicious or accuse others of things that didn't happen. This is not a reflection of their true thoughts or feelings. It's a result of changes in the brain and should be met with reassurance rather than argument. At other times, your loved one may seem distant. They may stare off into space or seem unaware of your presence. You might call their name and receive no response. Or they might respond slowly, as if it takes time to process what they are hearing. These moments can feel heartbreaking, but your voice and your touch still matter. Even if they don't respond, many people can still feel the presence of those they love. Mental alertness may also fade during conversations about the future or practical matters. They may not be able to make decisions like they used to. They might struggle to understand paperwork or follow along when someone explains a medical plan. This is a sign that it may be time for loved ones to step in gently and help with choices, while still honoring their voice and preferences. All of these changes can be exhausting for both the person and those who care for them. It's important to take breaks when needed and reach out for support. If you're not sure whether what you're seeing is normal, you can always speak to a doctor or nurse. They can help explain what's happening and suggest ways to make your loved one more comfortable. There are also things you can do to support someone with declining mental alertness. Speak in a calm and steady voice. Use simple words and short sentences. Give them time to answer. Try not to overwhelm them. Make the environment quiet and peaceful. Avoid loud sounds or bright lights. Familiar objects, music, or photos can help soothe the mind and bring comfort. If your loved one becomes confused or anxious, gently remind them that they are safe. Let them know you are there and that they are not alone. Even if they don't remember everything, they will still feel the warmth of your presence. They may forget your words, but they won't forget how you made them feel. Mental decline is one of the most tender signs to witness. It touches our hearts in deep ways, but it also opens a door to new kinds of connection. You don't always need words to show love. A soft touch, a gentle smile, sitting quietly beside them, these small acts can mean everything. As we continue, we'll talk about another sign, one that often goes hand in hand with physical and mental changes, emotional withdrawal, and shifts in personality.